For the first time, the U.S. Surgeon General has explicitly linked serious mental and physical health conditions to workplace environments. In a new report, Dr. Vivek Murthy refers a number of times to what he calls toxic workplaces and how they affect Americans' well-being. He specifically cited the pandemic for shedding light on the importance of maintaining a healthy work-life balance. And joining me now is the man himself, the Surgeon General, Dr. Vivek Murthy. Dr. Murthy, 84% of people say their workplace has been a factor in one or more mental health challenges, according to a poll that you cite in your recent research. Why is that number so high?
Well, John, I worry that that number has been high for a while, and we just haven't been paying enough attention to it. It's undeniable that our workplaces have a powerful impact on our mental health. And the pandemic really shed light on that. It pulled a curtain back on, I think, what many people had been experiencing. And people have been going through a reckoning, asking themselves what they really want out of work, but also what they're willing to sacrifice for work. And that's part of the reason, John, where we see that over 80% of people are now saying that they want to work in a place that supports mental health and well-being. This is the reason I put forward, for the first time from our office, Surgeon General's framework on workplace mental health and well-being to lay out 5 essentials that form the foundation, if you will, for mental health and well-being in the workplace, in hopes that workers and employers could use this to help build a healthy and supportive workplace.
And in case people don't remember, it's not just kind of a mental health crisis that might be exacerbated by stress, but it also leads to all kinds of issues with things like cancer and diabetes and other things. But give us those 5 recommendations that you would make to workplaces.
Absolutely. And just to underscore what you're saying, that stress that people experience in the workplace, when it's chronic in particular, or when it's severe, it can have a real impact both on our mental and physical health. The flip is that if you actually have an investment in mental health and well-being in the workplace, that not only helps the worker, but it actually helps workplaces by improving productivity, by improving employee retention, enhancing creativity in the workplace. So this is really a win-win. And the 5 key essentials that we lay out focus on protecting employees from harm, helping build community and social connection, recognizing when people are connected to each other, they're much more productive and creative. Third, focusing on growth in the workplace, making sure people have opportunities to learn, to grow, to get feedback. Fourth, making sure that people know that they are valued, that their work matters and that they matter. And then finally, focusing on work-life harmony. For too many people, the line between work and non-work time is too blurry. They don't have time to take off when their children are ill or when they have an acute emergency themselves. If we can support employees in having a better balance and being able to care for their responsibilities outside of work, that contributes to their overall mental health and well-being. So these 5 essentials form the foundation for mental health and well-being in the workplace.
It feels like all 5 of those are aimed at the same thing, which is replacing a life of work with a life of meaning, focusing on meaning rather than just productivity and work when you think about the way employers treat employees.
Yes, and the meaning is actually very important. And one of the pieces we make under the idea of being valued and mattering at work is that people need to know that they matter and that their work matters. And that doesn't mean that your job has to be about saving lives or about solving world hunger, as laudable as those 2 goals are. But if you're a custodian working in a school and you're helping to keep the floor clean so that children can come and learn in a healthy, clean environment, that is meaningful. And it's important that people know, regardless of where you are in the work spectrum, whether you're working in a factory, whether you're working, in a school on the front lines, whether you're working behind a computer, that all workers deserve support for their mental health and well-being. And again, when they get that, they're better off not just at work, but at home as well. So this framework for mental health and well-being in the workplace is not only about work, it's actually has a broader benefit for society as a whole.
And finally, Doctor, just switching gears, I can't let you go without asking you about what we just reported on, which is some medical experts are warning about a rise in COVID-19, flu, and RSV this winter. Give us your assessment about that and what can be done to avoid that pileup.
Well, John, I think it's reasonable to be concerned right now. I am concerned myself. We still have COVID around. We've seen flu cases on the rise. We've seen certainly RSV on the rise. And our hospitals, our children's hospitals, are feeling the brunt of these increase in cases. And I know that in part because, I have a 4-year-old myself, and yesterday I ended up in the emergency room with her after she got a respiratory virus and was having difficulty breathing. So this can be very scary for parents and for all those, who are involved in the care of children. But the good news is when it comes to COVID itself, we do have vaccines for children. We have an updated vaccine, in fact, for kids 5 and up, and there are vaccines available more broadly for kids 6 months of age and up. We also have a flu vaccine that children 6 months and up can get as well. For RSV, even though we don't have a vaccine, we do know that it spreads like other respiratory viruses. So making sure you stay home when you're sick, you avoid contact with people who are sick in terms of hugging, shaking hands, and also making sure that you're taking as many precautions as you can in terms of washing your hands. If you're going to gather with other folks, ask if other children in particular are sick, and if they are, ask them to stay home. These are measures we can take to try to protect ourselves during what is potentially going to be a challenging season. But we have tools, we have vaccines. This is time for us to use them.
What about masks? Should those of us who are worried maybe wear one?
Yeah, so great question. So masks have proven to be very useful in reducing the spread of respiratory illnesses, not just COVID, but other viruses as well. And so certainly this is a tool people should keep in mind and reach for, especially if you are someone who's at higher risk because you have either lung disease or other medical conditions that put you at higher risk, or if you've got folks at home who are at higher risk.
All right, U.S. Surgeon General Dr. Vivek Murthy, we hope your daughter has a speedy recovery. Thank you so much for being with us.
Thank you so much, John. I appreciate that.